CNA Depression Engagement Strategies. Welcome to the quiz. Question 1. A resident with expressive aphasia, difficulty speaking, is trying to tell you something and is becoming frustrated. What can you do to help facilitate communication? Option A. Remain calm, give them your full attention and plenty of time, ask simple yes/no questions, and encourage them to point, use gestures, or use a communication board. Reassure them that it's okay and there's no rush. Option B. Tell them to slow down and speak clearly so you can understand. Option C. Finish their sentences for them to save time and reduce their frustration. Option D. Walk away and come back later when they are calmer and less frustrated. The answer is A. Patience and alternative communication methods reduce frustration. Option A is correct because it reduces frustration by being patient and using alternative methods. Option B is incorrect because they may not be able to control their speech. Option C is incorrect because finishing sentences can be frustrating and inaccurate. Option D is incorrect because leaving avoids the issue. Question 2. The care plan states that a resident requires total care for bathing. This means: Option A. The resident is completely dependent on the nursing assistant to perform the entire bath for them, from start to finish, with no participation. Option B. The resident only needs help with washing their back and feet. Option C. The resident can bathe themselves with minimal setup of supplies. Option D. The resident needs supervision and verbal cues for safety during a bath. The answer is A. Total care means complete dependence on staff. Option A is correct because total care means the resident cannot participate at all. Option B is partial assist. Option C is minimal assist. Option D is supervision. Remember, we can take your CNA exam for you, remotely and undetected, and with 85% score guaranteed, no fails, no upfront fees, no deposit, pay only after results. Message us via number in bio to schedule your session. Question 3. A resident who is on bed rest needs their linens changed. What is the first step in performing an occupied bed change? Option A. Explain to the resident step by step what you are going to do to gain their cooperation and reduce anxiety. Option B. Lower both side rails to have full access to the bed. Option C. Remove all the soiled linens at once to get them off the bed quickly. Option D. Roll the resident to the far side of the bed and raise the side rail on that side for safety. The answer is A. Explaining the procedure first helps the resident understand and cooperate. Option A is correct because explaining the procedure first helps the resident understand and cooperate, reducing anxiety and ensuring safety. Option B is incorrect because lowering both rails is unsafe. Option C is incorrect because removing all at once leaves the resident exposed. Option D is incorrect because rolling without explanation may startle. Question 4. What is the main purpose of a client care plan or service plan? Option A. To outline the specific, individualized care, goals, and interventions for a resident based on their initial and ongoing assessments to ensure all staff provide consistent and appropriate care. Option B. To provide a daily work schedule and task list for the nursing assistants. Option C. To list the medications a resident is taking and the times they should be given. Option D. To inform the family of the resident's medical condition and progress. The answer is A. The care plan is a guide for consistent, individualized care. Option A is correct because the care plan is a guide for all staff to provide consistent, individualized care. Option B is incorrect because it's not just a task list. Option C is incorrect because medication list is part but not the whole. Option D is incorrect because it's for staff, not primarily for family. Question 5. While assisting a resident with a meal, you notice they are pocketing food in their left cheek. What is the most appropriate action? Option A. Gently remind them to chew and swallow and offer a small sip of liquid to help them swallow. After the meal, Check the affected cheek for any pocketed food and remove it gently with a finger or toothbrush to prevent aspiration or mouth infections. Option B, ignore it, as some people naturally hold food in their cheeks while chewing. Option C, give them a different texture of food that is easier to manage. Option D, reach into their mouth with your fingers and remove the food immediately. The answer is A. Addressing pocketing safely and checking afterward prevents aspiration. Option A is correct because it addresses the pocketing safely and checks afterward. Option B is incorrect because ignoring can lead to aspiration. Option C is incorrect because changing texture may not be necessary without assessment. Option D is incorrect because reaching in can cause injury or aspiration. Question 6. The RACE acronym is used for fire safety. What does the C stand for? Option A, confine the fire by closing all doors and windows to prevent it from spreading. Option B, call the fire department after removing those in immediate danger. Option C, carry everyone out of the building. Option D, cool the fire with water from an extinguisher. The answer is A. RACE stands for rescue, alarm, confine, extinguish. Option A is correct. RACE stands for rescue, alarm, confine, extinguish. Option B is A, alarm. Option C is not part of RACE. Option D is not part of RACE. Great job. Don't forget to subscribe. Bye.